Hi, everyone. This is Kirsten. Welcome to this week's episode of Weekly Hope. We're so glad that you are here. We do this show every single week here on the Eating Disorder Hope and Addiction Hope Facebook pages. We like to bring experts to you, interview, super conversational, informal kind of thing, get you guys information, cover cool topics, and of course, hear your questions, your thoughts on a wide range of subjects within the mental health field. So that's why we're here. That's what this show is all about. If you stumbled upon us on Facebook, welcome. If you're joining us again and you are a weekly viewer, welcome back. We love when people watch the show every week and leave their comments and leave their name and say hello. We've got lots of friends out there who tune in. So if this is your first time, hey, maybe something to make a weekly habit. But we're really super thrilled that you're here. And I would be amiss for those of you that do tune in every week if I didn't bring my co-host onto the screen. This is Miss Elsa. She is my nugget, and she co-hosts the show. She sits on my lap and makes sure that we have a successful show every single week. So Elsa is here. And another fun thing that I wanted to tell you all today is, as you can see, this is not the normal background here. I am broadcasting live from Paris today. So Elsa is finally in her spirit home. She is a French poodle, and this is her first time to Paris. And it's not my first time to Paris, but it's really good to be back. So I am here, and we're an international show. So, and that being said, please let us know when you leave a comment. Let us know where you're signing in from. Please tell us your name and let us know from where in the world you are tuning in, because we always get some really wonderful surprises of people from all over the world that are watching this broadcast. So please say hello throughout the show. Let us know that you're here. So with that, I want to dive into our topic and introduce our guest. And this is a really neat and interesting topic, especially now. And it's something that I don't know much about, so I'm really excited to learn from Dr. Carnes, our guest, about this. So without further ado, let's invite our guest onto the screen here. And there we have Dr. Carnes. Hi, Dr. Carnes.
Hi, good morning, Kirsten.
Hey, so I'm just going to read a little bit about Dr. Carnes, and so you guys can get a little bit of an idea of who she is and her incredible wisdom. So Dr. Carnes is a clinical sexologist. She's a marriage and family therapist and a certified sex addict. She's the president of the International Institute for Trauma and Addiction Professionals, which is a training institute and professional organization for addiction professionals. She's also a senior fellow at the Meadows Behavioral Healthcare, where she works with sexually addicted clients and their families. Dr. Carnes is the clinical architect for Willow House, relationship healing for women struggling with sex, love, and intimacy disorders, and of course works closely with the staff of Willow House and Gentle Path to bring her unique expertise to the programs and help the clients who suffer with these issues. So that's just a small bit of all the amazing work that she's done, but we are very honored to have her here today to talk about co-occurring disorders in women that include, of course, sex addiction, love, and intimacy disorders. So Dr. Carnes, you rock. We are honored to have you.
Thank you.
Yeah, and just to let our viewers know, where in the world are you signing in from today?
From Phoenix, Arizona.
Phoenix, Arizona. Lovely. You probably have a lot better weather than we do over here. It's very gray and feels very fall-like.
It's gorgeous right now. 75, sunny, beautiful.
Oh my gosh. It's amazing. It was a super hot summer for so many people in the United States as well as here in Europe. And already, it's cold and I'm missing summer. It's funny how your body and your mind forget. So, but anyway, okay. So before we dive into our topic, why don't you let us know a little bit about the work that you do, not only with the IITAP, but then also your work at the Meadows and what you did in constructing the program at Willow House.
Sure. So ITAP stands for the International Institute for Trauma and Addiction Professionals. And basically we're a professional organization that trains and certifies people in the areas of addiction and trauma. And one of our most well-known certifications is the Certified Sex Addiction Therapist credential, which is very widely respected. And we have about 2,000 certified sex addiction therapists all over the globe. And so it's also international. And so it's a specialty area of focus, but we also do trainings in trauma and eating disorders and chemical dependency and financial disorders like gambling addiction and that type of thing. So that's one of my hats that I wear. The other hat that I wear is, as you mentioned, I'm a senior fellow at the Meadows. So I work primarily with two of our programs. One is a men's sex addiction unit. It's a residential program, 45 days, for people that have basically destroyed their lives with their sexual behavior. And we just opened a year ago a women's unit for sex, love, and intimacy disorders. And since we've been open, it's one of the only facilities of its kind. It's also residential. There's very few facilities for women. And we've been very busy. So it was obviously much needed. And it's really been exciting to get the chance to get the word out that this is also an issue that women struggle with, not at the same prevalence rates that men do, but still, they can also struggle with, pornography and sex and love addiction.
Yeah, and I can't wait to talk a little bit about the stigma, shame associated with this, because it's a huge topic. But I would love to know, how did you get into this work? Because, it's something that we are starting to, when I say we, I mean in the general public, are starting to hear more about. But you've been doing this work now for a while. So how did you get into the field to begin with?
Sure. So initially, I didn't want to do this line of work because my father actually works in this line of work. And so he's a very well-known person in the field. He's a lot of people talk about him as being sort of the grandfather of the field because he wrote some of the very first books on sex addiction and, was one of the first people to be on talk shows like Donahue and Oprah in the 80s to talk about sex addiction. And so when I was finishing school, 25 years ago, I went into medical family therapy because I didn't, wanted to do something different. And I taught was a professor at a university, University of San Diego for a while. And he kept on, chipping away at me and saying, come do this project with me, come do this with me. And eventually I got recruited to when he had a program that was in Hattiesburg, Mississippi for a period of time. And so I went and was the director of that program. And, so I ran that inpatient residential program for many years, and we worked side by side, doing research and, treating clients together. And so it was, not initially something that I was interested in, but then over time it became more and more interesting to me as I, developed myself professionally.
Yeah, so cool. And your father is amazing and has been a really, really wonderful friend to us here at Eating Disorder Hope and Addiction Hope over the years. He just presented at our Addiction Hope conference, and yeah, he is pretty much a legend. But so it's really, really cool that you're able to have that both family and professional relationship, and it's a good one. So yeah. really
great for us to work together over the years.
Yeah, amazing. So can you talk a little bit, you mentioned prevalence just very briefly in your answer before, but can you talk about the prevalence and how often sex addiction, love, and intimacy disorders are co-occurring with things like eating disorders?
Sure. Yeah. So right now, the current best estimates in terms of prevalence rates for sex addiction among the general population are like 2 to 6%, depending on which study you look at. So it's actually a lot more common than people think it is. There's only been one study that I'm aware of that has looked at the rates of eating disorders among sex addiction clients, and that it came in at around 35%. And one of the things that I would say, yeah, it's much higher than people think. But one of the things that I would say about that is that it is typically bulimia or binge eating that tends to be the problem. We don't have high rates of co-occurrence with anorexia. Even in our female population, it's much less common. It's mostly bulimia and binge eating disorder.
Yeah. Does that have anything to do, and you might not have any idea, but I just ask because I personally struggled and recovered from an eating disorder. That's a big reason why I am in this field now and so passionate about it. But just to be super open and honest, I struggled with anorexia and I didn't feel anything, like no love, no passion, no like just emotionally completely dead inside. And I know that the answer is probably much deeper and complex and clinical than I'm making it out to be, but it just seems to me like that would make sense, because when you are at so malnourished and at such a very low weight that you have no emotional response.
Yeah, I think that makes a lot of sense for anorexia. I think the reason why, and I don't think we see that same emotional response as much with binge eating and bulimia. I think we see a lot of emotional dysregulation, a lot of pain, and people being very like almost over emotional as opposed to numb, and so from that standpoint, we have there's a lot of similar activity going on in the brain with people that have binge eating and bulimia and compulsive sexual behavior, because the same areas in the brain, the reward center is very much activated in a very similar fashion as it is with chemical dependency. But anorexia does not have that same pattern in the brain. And so we really do see differences between anorexia and bulimia and binge eating. So a lot of times with bulimia and binge eating, it parallels a lot more some of the other addictive processes like chemical dependency and compulsive sexual behavior, in which you have a lot of emotional dysregulation, a lot of shame around the behavior, a lot of depression and anxiety that goes along with that.
It's so fascinating that, and even though, some of us can be coming from the spectrum of having struggled with an eating disorder or substance abuse or, a love or intimacy disorder, but there are so many similarities. And so, I mean, obviously the way that the brain functions, that it can, at least I find that my empathy doors in my heart are so open to people who struggle with things that I've never struggled with, because I understand the processes and I understand and I remember what that feels like. And it's just, it's so fascinating.
And one of the things that I would add to that is that the research also shows that people that have more than one addiction tend to have a lot of trauma in their background. And so sort of like the more trauma you have, the more you're trying to medicate that pain. And so, it just makes a lot of sense of why people are reaching for all of these different methods, whether it's sex or food or chemicals, to try and self-medicate.
Yeah, absolutely. And I see that we've got some new viewers that signed on. So if you're here, if you're just joining us, please say hello. We love to hear from you. Tell us your name, where you're signing in from. And of course, if you have any questions for Dr. Carnes, this is your opportunity to ask those. We'll bring them up onto screen, and I'll make sure that those get into the queue here. So please let us know. But all right, so can you describe, let's just maybe get a definition here. Can you describe what sex addiction actually is, and the difference between, say, a sex addiction and a love and intimacy disorder?
Sure. So we talk about, so some people, just so for your viewers to know, is, obviously there's been a lot of controversy around the diagnosis of sex addiction. And it's actually not in the current DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. However, it was just recently put into the ICD-11, which is the International Classification of Diseases, which is what physicians use. And they put it in there using the terminology compulsive sexual behavior disorder. Now, they did release an article that said there's still a lot of research out there that indicates that this could be a behavioral addiction. So it's really not sure ultimately what it's going to be called, but at least we have a legitimate diagnosis that people can use. And so it went a long way, putting that in the ICD went a long way to helping legitimize the condition, which is really important because of that stigma that you were talking about earlier. So if you look at the literature, there's a lot of different terminology that people use to talk about sex addiction. So some people look at it as sex addiction. Some people talk about compulsive sexual behavior. Other people talk about hypersexual behavior disorder. So there's lots of different terminology that's used, but there's really a lot of agreement among researchers about what the symptoms are and how to classify and what the constellation of behaviors are that make up the condition. But sort of just a lay definition for sex addiction would be that it's a pathological relationship to a mood-altering experience that's sexual in nature, that despite adverse consequences, the individual continues to engage in. So, most people struggling with sex addiction, their behavior will be out of control. There will oftentimes be an escalation over time. They will have hurt their, they might have lots of consequences. So, health consequences, financial consequences, job loss, those types of things are surrounding their behavior. Lots of time spent, a lot of preoccupation around the behavior, lots of shame and guilt. Sometimes feelings of distress if they're not able to access the behavior. And when we're talking about compulsive sexual behavior, the most common things are like pornography addiction, obviously, things like prostitution, anonymous sexual hookups, and, just lots of casual sexual encounters. Today people are using a lot of different apps and digital media for just, kind of hookups, that type of behavior. So that would be the most common types of behavior. So that's sort of contrasted with what we would call, like a love or relationship addiction, which is where it's more like in relationship addiction, where you just have one relationship right after another, serial relationships, one always on the back burner. So it's more about the experience of falling in love, and always having multiple relationships going on at the same time. So oftentimes those will those co-occur. So you have a lot of people that struggle with both issues. So that can be pretty common.
So interesting. And Deborah says hello. Hi, Deborah. Deborah Ann Gibson Lewis says hello. Hey there. So I'm just thinking, how do you know if you are that person who actually has, say, a very disordered relationship with intimacy and relationships, or if you're just a normal person in the 21st century trying to date?
Yeah, that's a really good question, because one of the things we want to be careful of is we don't want to over pathologize people. There's a lot of people that will recreationally use porn or Tinder or whatever. And, just because someone is having, casual sex or using pornography recreationally, that doesn't mean someone has an addiction. So what we're looking at is people whose lives are really out of control. And so like people spending, 30 hours a week on porn, it's getting in the way of their functioning at work. They're taking risks that they normally wouldn't be taking. It's interfering with their relationships, for example, or, people that are having many, many sexual encounters, spending, like I had a patient recently who spent $300,000 in 1 year on prostitutes. So that, just imagine how many sexual encounters that is. And so we're really looking at out of control behavior. And when, in the setting that I work at, which is an inpatient setting, obviously we have clients that are really in acute distress around their behavior and have completely destroyed their lives. So they've lost their families, they've had major health consequences, they've had financial losses. And so that's, we really want to make sure that we're not just overdiagnosing, because one of the things that happens with sex addiction is it's a very common term in our popular culture. And so a lot of people will say, oh, he's a sex addict, she's a sex addict, without really understanding the meaning of that. And so sometimes we'll get people coming in that will have some what we call moral incongruence with their behavior. So they feel bad about their behavior because of their value system. And so they'll say, like they'll come in, I've had people come into therapy, for example, and say, I view porn once a month, and it's very stressful for me because it's against my values. And so I think I'm an addict. And really someone like that just wouldn't meet the criteria for an addiction. Right. And so and sometimes it's hard to differentiate, because it's like chemical dependency, where you have some people who recreationally use and to the point of abusing, and are they a drug addict or not? So this is a continuum of behavior. And so, but again, we always as clinicians, we always go back to the criteria, and do they meet enough of the criteria to actually see if they would, have a disorder.
Yeah. And I obviously, I think there we go.
Kirsten, yeah, you just cut out on us for a second, but I think I got you back.
I think I'm unfrozen.
Yes, you're unfrozen, yeah.
Okay.
So we didn't hear anything you just said.
Right. Sorry about that. I was just saying that I think that an important thing that you mentioned, that it's a professional, a treatment professional, who can help you figure this out. It's not something that you can necessarily do on your own. And especially if you have gotten into a disordered or unhealthy relationship with another person, or with a sexual activity or behavior, or all of those co-occurring issues like we talked about, we're not in the right headspace to evaluate our own health. So if you have a suspicion about a loved one, that it's important to involve a professional, because they're the one that can do the diagnosis, not you.
Yeah. So just as a resource for your people, we have a website called sexhelp.com, and it has a listing of all of our certified professionals on it that are, certified sex addiction therapists, and you can just enter your zip code and it will pull up the one nearest you. So if you go to sexhelp.com and it says find a therapist, you can pull up the listing, and they're all over the globe. They're in 30 different countries. We have a lot in Canada, like 150 in Canada, and all over the US.
Amazing. That's a really, really awesome resource. So I put the website up on the screen if anyone wants to check that out. And I will also put it in the comment section after this video is over. And we've got some new people joining us. So hello and welcome. We're here with Dr. Carnes talking about women and sex addiction and love and intimacy disorders. Super interesting, engaging topic. So if you're just joining us, say hello, let us know your name, and of course, open to questions at any time. And we've got Janet who said hello. Hi, Janet from Nebraska. welcome to you. I'm going to put that sexhelp.com back up on the screen so that people can go there. Okay, so let's talk a little bit about the stigma of women struggling with these issues. It seems like when I first started to hear this term, it was in reference to, I think, Tiger Woods several years back when I'm not a clinician. None of us can diagnose him in any way, but when he was having issues with his wife and multiple affairs and all of these things, and it came out then that he was seeking treatment for sex addiction. Then recently in the Me Too era with some of these very prestigious, very famous men who then have been accused and found guilty of sexual harassment and sexual abuse, now then seeking treatment for sex addiction. So while on the one hand, it's probably good that people are talking about these issues more because awareness is a good idea. At the same time, do all these big names getting associated with this, is that really the truth of the issue?
Yeah.
And what does it mean for women who be like, I'm not Harvey Weinstein. If I'm a sex addict, does that mean I'm going to be abusing people?
So one of the things that's really important to keep in mind is that whenever someone's sexual behavior includes a lack of consent, and it includes a victim, and it includes exploitation, that is offending behavior, sex offending behavior. But a lot, people that are struggling with that, that type of behavior, they don't say, I'm a sex offender. They say I'm a sex addict, and they try and go to sex addiction treatment, right? But it is important. The media gets really confused on what sex addiction is, and they often call sex offenders sex addicts. Like a good example was the Craigslist killer. I don't know if you remember that. They called him a sex addict. Or Castro that locked the women in his basement, they called him a sex addict. And a lot of people that have really assaultive type behavior or really grim behavior, like the Craigslist killer. I mean, that guy is a sociopath, and some of the individuals have very severe personality disorders, like narcissistic personality disorder and things like that. So that's not sex addiction. The vast majority of sex addicts do not have personality disorders, do not have narcissism. It's about only about 17% of sex addicts have personality disorders, and only about 7% from the one study that we have in this have any issues with abuse of power. So the vast majority of sex addicts, like I mentioned earlier, prostitution, pornography, that type of thing. Now, there are times when you can have some overlap. Like, for example, I worked with a client recently who his behavior was, he was a porn addict. He was viewing porn about 30 hours a week. It escalated to having orgies and sex hookups, and affairs, escalated to swapping, behavior. And eventually he was having sex with people at work. And then he was a university professor and had sex with students. So then his behavior became predatory and had a victim and exploitative, but he was also had compulsive sexual behavior. So sometimes we'll see some overlap in those populations, but it's not that often. It's not as often as you might think when you hear all these people in the media, for example. So what we look at is we always want to make sure that when somebody is doing offending behavior, that it's acknowledged as really, as it is what it is. We don't want to mince our words around that. That's, it's exploitation, it's predatory, and it's not just sex addiction. So I think that's really important. And women, I won't say that I would say it's rare for women to have predatory behavior, very rare. So that's just not the typical profile that we see with women. So we see most women, when they're struggling with sex and love addiction, will look kind of like your standard sex addicts, struggling with a lot of promiscuity and anonymous hookups and, pornography. affairs and relationship issues. And so that's a much more common presentation. Now, when we're looking at women, when we look at prevalence rates, we see it's about 3 to 1. From male to female. So it's obviously much more common in men, but we're seeing more and more women come forward. And part of the issue is that it's so much more stigmatized for women. And so a lot of women don't feel like they can come out and get help when we're seeing a lot of women struggling. As a matter of fact, they talked about last year, 2017, if you look at Pornhub, some of their statistics, they're calling it the year for porn for women, because the porn rates doubled, almost doubled. They went from 17% to 30%. And so we're seeing a lot of women, getting more, having more sexually compulsive behavior. So anytime if you look at, one of the things with addiction, if you look at whenever you have increased availability of a substance or a behavior, you have increased rates of addiction. So for example, places that you have more meth labs, you have more meth addiction. Places where you have more gambling, you have more gambling addiction. Places where there's more bars, you have more higher rates of alcoholism. So now we're having more and more women getting online, getting exposed to porn, and not all of them, a lot of women will use porn and not struggle with it and not have a problem with it. But just like men, there's a percentage that will develop addictive behavior from that. And so when as higher rates of porn use going up with women, we're going to start to see higher rates of addiction among women. And fortunately, we're getting, the word out that this is something that is also that women struggle with. So hopefully they'll feel more confident that treatment is available for them and help is available for them.
Yeah, absolutely. And we talk about a lot in the field of in the world of eating disorders, as well as trauma recovery, substance and chemical abuse, about the underlying emotional issues, right? That the way that those manifest might be in an eating disorder, compulsive eating behaviors, or weight control behaviors, abuse of a substance. What are the kind of foundational issues with sex addiction or love and intimacy disorders similar? Is it because, I find so often when I talk to people who have recovery stories of their own, that it's a self-worth, it's a significance thing. It has to do with identity. It's these very, very deep underlying questions. Is that a similar thing with sex addiction? And and before you answer that, what I'm trying to do is help, because I think for people who are maybe not, where they're maybe hearing for this for the first time, and it might be hard for them to hear all of this, a way to say, like, no, you might be caught up on the sex thing in your head as you listen to this, but really it's about these foundational emotional issues that we all struggle with at some point in our lives. Severity depends, but this is just the way that it's manifesting itself.
Right, exactly. So we have very high rates of trauma, especially in our female population. And so, physical, emotional, sexual abuse, neglect in the background is extremely common. And, also mood disorders like depression, anxiety, bipolar, PTSD. For men, ADHD, very, very common. So, people, when you grow up and you're struggling with some of these things, it does create some of that, low self-esteem and shame and issues of, self-worth. And that's really painful. And people look to medicate that. Now, one thing I will say that's a little bit different with sex addiction with this is we do see where there is some research that is looking at sort of the difference between what we're calling classic sex addicts versus contemporary sex addicts. And one of the things that we're finding is there is a group of young people that are having exposure to graphic online content at a very early age. And so we have, in that group, one of the things that we're finding is not all of them have that same kind of trauma history and attachment issues that we have in the classic sex addicts. Some people are just getting online and getting some very graphic exposure and sort of being sexually conditioned and having a lot of and addiction just developing to that intense online content that is very overwhelming for a young brain to experience. We have people at seeing porn at 8, 9 years old. And so that in and of itself may be traumatic, depending on what they're being exposed to. But, that population is a little bit different than what we're seeing with sort of the classic presentation, which is a lot of trauma, family of origin issues, that type of thing.
Yeah, so interesting. Thank you for talking about that. And just want to say, Nikki. Deborah said she's letting us know that she's signing in from Nashville, so that's super cool. Welcome, Deborah from Music City. And then Nikki also. Hey, Nikki, thank you so much for tuning in, and says thank you for this amazing video, which is helping so many. That's awesome. And want to welcome you guys too. If you're just joining us, to please let us know your name and say hello, and do not be shy. I know this is a tough topic, so it might be difficult to ask questions, but feel free. And if you're watching this video later as well, feel free to ask a question, and we will absolutely try to get to it, answer, and provide you with good resources. And then the Kirsten Haglund Foundation says hello from Michigan, and that's usually my mom. So, hey, Mom. Thanks for watching. Okay, so with all of that, and want to mention to you guys, please, if you do have a question or a thought, please let us know, because we're nearing the end, and I just want to make sure that we get Dr. Carnes to answer those questions. So I see you out there. Whatever's on your mind, just please let us know. Okay, how has this conversation changed in light of Me Too? Because maybe it has, maybe it hasn't. I just think, and we talked about it a little bit before with the, some of these more prevalent men, saying they're going into treatment for sex addiction. It seems like we're talking about this stuff more, but I don't know. Is it better or worse in your view?
It's complicated, because I feel mixed about it. Because on the one hand, every time sex addiction is in the media and attention is brought to it, there's opportunities to educate, and there are a lot of people out there trying to do that. I think it's usually very positive when it's somebody like David Duchovny or Tiger Woods, and it's people are able to put like a friendly face and say, oh, that's somebody who I've, could relate to, and they're struggling, so maybe I could go get help for my, addiction. So that, then I see it as positive. When people with, as I mentioned, offending, predatory exploitative behavior are, mislabeled as sex addicts, then, I think that's confusing for the public. But at the same time, it still presents an opportunity to educate. So it's a little bit of a mixed thing. And I just continue to hope that people will stand up and, when they're struggling, and acknowledge that this is real, and continue to destigmatize it. The same thing happened if you look back at, we're kind of where alcoholism was like 30, 40 years ago. We used to look at alcoholism as a moral failing and a lack of willpower. And, it wasn't until people like Betty Ford stood up and said, hey, this is a real problem. This is an illness, that it started to draw the attention to it that it needed, and it started to become destigmatized, and resources became more available. And so, we have a long way to go. It's getting better, but we still have a long way to go.
Yeah. One thing, and then we'll move on to my last question. One thing that I was just thinking about as you were talking that I feel hopeful about is that I think you're just seeing a lot more awareness on what kind of behavior is appropriate and what kind of behavior is not with the opposite sex.
Right.
especially in both personal and professional settings. And maybe, for most people, that's like, okay, just to check on themselves. But for others who maybe are more compulsive in their habits in private, and then that comes out in comments or things like that in the workplace, that kind of heightened awareness might help them to say, oh yeah, I actually need help.
Right, absolutely. The people that have, because one of the things that sex addicts struggle with is because they're preoccupied with sex, they will struggle with sexual boundaries and will, objectify people and fantasize and really, have a lot going on in their head around all of that. And a lot of times, sex addiction is, we talk about it being a disease of profound boundary failure. And, so we see that a lot. And so they will oftentimes have inappropriate boundaries. So anytime there's education about what is appropriate and what isn't appropriate, it's, I think, helpful for people that struggle with these issues. Definitely.
Yeah, absolutely. So last question here, and I see I'm starting to get a little bit blurry again, so sorry guys. How, just give us some hope that people can fully recover, and also to those family members who are supporting a loved one going through this process.
Well, there's absolutely hope for people. People do recover from this. There is a lot of help out there. There is, the S fellowships like Sex and Love Addicts Anonymous, Sex Addicts Anonymous, Sexual Compulsives Anonymous, Sexaholics Anonymous. Those are the most common S fellowships. Are global. There's like 80,000 groups or something crazy like that. And they're all over the world. I travel to speak a lot. So they're in China, they're in Dubai, they're in, Africa. They're all over the world. And so there is, and now we're getting more therapists out there trained on how to work with this, with protocols that work. There's more evidence-based treatments. And I know a lot of people who have successfully recovered from this. So there absolutely is hope. And I would say that to family members too. I mean, obviously, for families, this is devastating. It's very hard for partners to learn about this and hear that their loved one is an addict. And with all the misinformation, a lot of times partners will be like, is this really an addiction, or is this just bad behavior, or is this an excuse? And so that will, it's very emotional for them. We look at it as a trauma for partners, that it's traumatic for them to learn about their loved one's addiction. And so oftentimes the treatment involves also extensive family therapy and extensive couples therapy. It's so important for them because they're traumatized, and sometimes so are the children, depending on what the consequences have been around the addiction. So I always encourage partners and say, you need as much support as, the addict does, because a lot of times, when people are going through something traumatic like this, like if you look at, for example, this is easily as traumatic as like having cancer. And when people have cancer, we have support groups for them and bring them casseroles and Caring Bridge websites and all of that. And with sex addiction, a lot of people feel like they can't tell anybody and they just struggle alone, and don't get support.
Mm.
And really, they need support and they deserve support. So I may have lost you, Kirsten. You look like you might be frozen again. Are you there, Kirsten? Hi.
Yay!
Hi, there you are.
Oh, I'm so sorry. I was watching you doing the. Hold on, I'm going to read that one more time. Oh, and we have a
There you
great
are.
question. Okay.
Hi. Can you see me?
Hallelujah. I can see you just fine. I'm so sorry about that.
That's
Yeah.
okay.
So no, I was sitting there watching you all alone there, and I was like, I was trying to talk to you, and so that's why I typed on the screen. But no, this was really, really great, and thank you for your hopeful message. I just want to say, Dr. Carnes, thank you. We've got Dipcon who says hello, Caitlin Ann who says thank you for sharing your insight, Dr. Carnes. Yeah, you rock. And Emmy Lou says hi from Emmy Lou and Diana in Texas. Thank you for sharing hope for recovery regarding sex addiction. Definitely something we see our clients struggling with in our professional work. Good to hear from an expert on this topic. So, really, really great. So even though we didn't have anyone brave enough to ask a question, we know that a lot of people needed to hear this message, and also really needed hope that recovery is possible, and also hope for those family members. So I am going to put the sexhelp.com link in the comments section, as well as where should we send people to learn more about you and the work that you do? We should send them to the Meadows and Willow House if they're interested in that program on women that you talked about.
That would be fine.
Absolutely. Okay, so we'll do that. I'll put both of those in the comments, and I will be coming back throughout the week to check if there's any other questions. So if you're watching this video later, please let us know. And we're going to say goodbye and thank you very much to Dr. Stefanie Carnes. Yeah, absolutely. So thankful for you. And I'm gonna say goodbye to the rest of our viewers. So. You guys, thank you so much for hanging in there with me on the connection. I really, really appreciate it. That is such is the nature of Facebook sometimes, but thank you all too so much for your great comments, and for letting us know that you're here. That really, really makes a big difference, both to me and our guests as well. And just want to affirm you that if this is something that was really powerful for you, and you learned a lot and has just got your brain thinking, I just want to encourage you to pursue that. And also, if you are supporting a loved one out there, just know you are not alone, and that help is out there. Do not hesitate to reach out for support, because it is absolutely there for you. So I think that's all we got for today. Thank you so much for joining us. We'll be back with another episode of Weekly Hope next week, next Wednesday. So make sure to stay tuned to our Facebook page, Instagram, and Twitter account, and we'll let you know the guest and the topic. And of course, this video is yours. Please share. It's also going to be on our YouTube channel as well. So if you've got someone in mind who this might be a good thing for them to watch, then please feel free to share. We're here for you. So, all right, have a wonderful evening wherever you are in the world, and we will see you next week for another episode of Weekly Hope. All right, ciao, guys.